From the Toronto Star, I'm Raju Mudler, and this matters. The Omicron wave of COVID-19 has been moving through society at an incredibly fast rate. This pandemic has taught us a new math, one where we become used to looking every day and seeing what the case counts are as a sort of barometer for how we're doing. The incredible transmissibility of this strain of COVID has provided some explosive numbers, especially in terms of case counts. And as high as they are being reported, it's pretty clear in actuality they are much higher. With the breakdown of testing and contact tracing, there is other data that we need to be watching as this wave continues to potentially threaten to overwhelm our healthcare systems. Ed Tubb is an assignment editor at The Star, who's been focusing on COVID-19 data. He joins us once again to take us through the numbers. Happy New Year, Ed, and welcome back to This Matters.
Happy New Year. Happy to be here.
Ed, you've helped us make sense of these numbers throughout the pandemic, but this Omicron wave is just moving so quickly, and we're going to go through a lot of numbers, but as you've watched the numbers throughout the pandemic, let's just start with the very baseline. How boggling are the ones associated with this Omicron wave?
I guess that depends on how you look at it. The case numbers are incredibly larger than anything we've seen, and they're an extreme undercount, is what we're being told by public health officials, because the testing capacity in Ontario is not able to keep up with the speed at which Omicron is hitting this province. So to that extent, the numbers are big and bigger than we've ever seen, and that kind of strains your eyes to look at them a little bit. But it's not actually a surprise. When Omicron was first emerging in South Africa, this is exactly what happened there. And when that happened in late November, we saw reports go out across the world that this was coming, and you had experts looking at those reports and saying, this is going to happen here as well, probably, and now it is happening. So to the extent that the numbers are very large, they're hard to look at, they're hard to understand, and you need to know what you're looking at to really kind of make sense of them. But at the same time, they're not really a surprise. We've known that Omicron was coming to Ontario for more than a month, not much more than a month. And this is what happens when a virus that's this transmissible comes into a province like Ontario. It spreads incredibly quickly, faster than anything we've seen with COVID before now.
Okay, so where do we start? What are the numbers that we should be looking at now? I mean, case counts has always been the big one. We had a high breaking 18,000. As you said, that number is not accurate. It's much more. So what should we be watching right now?
There's lots of reasons why case counts are not the main thing right now. The number one reason is what I just said. We're not testing enough people to capture all of the infections in this province. And probably anyone listening to this podcast knows that. Because by now, most people listening to this podcast probably have family member or friends who've got sick and tried to get testing and maybe couldn't, or have relied on a rapid test or anything like that. I've got friends and family that have had that happen. I'm sure you have as well. And the result of that is that the case count, the very large case count, larger than ever case counts we're seeing, are an extreme undercount. And by how much we don't really know, it's hard to tell, but it's probably some multiple. So like when we look at a case count that says 18,000 cases in a single day, you're probably looking at 2 to 3 to 4 to 5 times that amount of actual numbers of infections in the province on that day. So those numbers don't really tell us a heck of a lot. The numbers that do tell us a heck of a lot are what comes after cases. So every case is an infection. Every infection is someone getting sick. And when someone gets sick, it takes some time for that sickness to become something that we might call serious. And if it's serious, that person might go to the hospital. And if it's very serious, that person might get admitted to hospital overnight. And we get a daily count of those numbers, the hospital admissions per day. That is a number that we should be looking at. And then beyond that number, we also see the number of those people who are not just admitted to hospital, but are sent to intensive care units. Those are the places for the critically ill people who need intensive care or they may die. And we need to look at those numbers as well. And those hospital numbers, they have a lag time. It takes some time for someone to get sick and go to hospital, but they are also rising. They're not rising as fast as those case numbers. Those case numbers are an incredibly quick exponential curve. Hospitalizations aren't rising quite so quick, but over the last couple of weeks, especially the last week, we are seeing them start to spike like we've seen in previous waves. And as experts explain to us, this is likely to continue over the coming weeks. So what a listener may want to look at when they're trying to understand how Omicron is hitting Ontario is those hospitalization numbers. Because at the end of the day, what counts the most is how many people are getting seriously ill and what kind of a strain is that putting on the hospitals who are treating those people. And right now that strain is growing, and that's what I'll be watching, and that's what everyone else should be watching as well, I think.
Where are they at right now, though, I guess, compared to the whole pandemic, I guess?
Right now, the hospitalization numbers are not quite back up to where they were at previous waves, right? So in wave 3, which was the worst wave for hospitalizations in this province, that's around April and May of 2020, we peaked at just below 2,500 hospitalizations per day in the province, like total, like people in hospital with COVID. And we peaked at around 700 to 800 ICUs, people in intensive care. The current numbers with Omicron are not close to that yet. We're looking at sort of 1,500 hospitalizations around about that level, and we're looking at around about 250 ICUs. Those numbers may seem quite a lot lower, but the problem is what we're seeing is that those hospitalization numbers are following that case spike with this lag. And when we're seeing hospitalizations start to spike very quickly, grow very quickly, we know because the cases spiked 10 days ago that the hospitalizations will probably continue to spike at a similar speed. So we do expect, and experts in Ontario expect, that those hospitalization numbers we're seeing today of around 1,500 concurrent hospitalizations are going to grow quite quickly and probably surpass what we've seen in previous waves. And the math behind this is really quite simple. When Premier Doug Ford announced the latest round of restrictions on the province, he said that he expects that about 1% of people who get infected with Omicron are going to go to hospital. And that makes for really, really simple math. That means if you're talking about 100,000 people getting Omicron, that's 1,000 people going to hospital. Or if you're talking 1 million people getting Omicron, that's 10,000 people going to hospital. Well, we're looking at case numbers that suggest that the Omicron wave is going to hit a significant portion of this province, like maybe even most of the people in this province. So the math behind what we expect to see in hospitals is very simple. You take 10 million people in this province of 15 million people, and you assume 1% of them might go to hospital, you get to very, very large numbers coming over the coming months. Now, that's broad, basic, back of the napkin math, but that's the basic idea. Those hospitalization numbers may not be there yet, but we do expect them to grow very quickly, and on the pace they're at, they will surpass the previous waves, probably by a lot, over the coming weeks.
The big talk with Omicron, of course, is that milder symptoms, but I mean, listen, that's very simple math and still could very much overwhelm our healthcare system, right?
Exactly. For comparison, that 1% number that Doug Ford quoted at the press conference is significantly lower than the rate of hospitalization we saw in previous waves. So if 1% of people with Omicron end up needing to go to hospital, that tells us that Omicron is hitting at a less severe per case rate than Delta, the previous wave, our wave 4 through September and November and part of December, when we were seeing 4% of every person infected going to hospital. So 1% is cut by 75%. That's hugely important. That helps us incredibly. And it does mean that on an individual basis, especially if you're vaccinated and especially if you're boosted, you can have pretty good confidence that Omicron is not going to knock you out. I'm saying this to people who might be younger or might not have immunocompromised conditions or things like that, right? Like many people do not need to think of Omicron as something that is a huge personal risk to them if they get it. They're much more likely to get it than they were in previous waves. But assuming that you're vaccinated and hopefully boosted, you should have good protection against getting seriously ill from Omicron. And of course, that doesn't include people who are at risk of conditions, who have immunocompromised conditions, who are seniors, very old seniors. Even with vaccination, we got to be very careful about how many of those people might get it. And of course, if you're unvaccinated, you're not going to have any protection against the virus that vaccinated people get. And if Omicron is significantly less severe than Delta, which seems like it is, you got to keep in mind that Delta was itself significantly more severe than the previous waves. So if you are unvaccinated, I don't know that we can guarantee that Omicron is going to be mild for you. We don't have a lot of evidence that says that's the case. When we say mild, when the experts are saying mild, what they're referring to is relative to the previous wave. And Delta was the most severe version of COVID that had gone through this province prior to now.
This is one of the things that I've been saying. What a doctor considers mild may not be very mild when it hits you. I mean, in medical terms, it's basically anything up to hospitalization.
We are seeing anecdotes from hospitals that what they're seeing per hospitalized patient is significantly different than with Delta. We are seeing anecdotal reports. I'm not sure this is something we would call data, but we're seeing anecdotal reports that when people are hospitalized with Omicron, they may not be so likely to need something like ventilation, a mechanical ventilator to make them breathe. That may not be something we see so often with Omicron, and that's encouraging. But there is a risk and a cost to a person being in a hospital bed. That is a strain on our hospital system. And that's something that I think is going to be the key thing to watch with Omicron.
We'll be right back. One of the things that you mentioned on your Twitter feed, and you mentioned this earlier, is about seniors and how they are now being affected by Omicron at record rates. What can you tell us about that?
That is the most concerning thing I'm looking at these days. When Ontario was first reporting record rates of Omicron infections, it was around Christmas Eve. We broke our previous record for cases in a day, back when the case numbers actually mattered. They were still accurate. They still were capturing what was happening in the province. We broke our record around Christmas Eve. But at that time, almost all of those cases were younger people. Omicron first hit the 20-somethings, the 30-somethings, the 40-somethings in this province. And it hadn't yet hit into the most vulnerable populations of seniors and very old seniors, the kinds of people who have been most likely to go to hospital with serious illness or die from COVID in the previous waves. So when we're talking about the worst risk for hospitalization and ICU and death, that is almost entirely fallen upon the oldest people amongst us. Like the vast majority of deaths from COVID in Ontario have come from people over 70. And until the new year, we weren't seeing extremely large numbers of Omicron cases in that population. But now we are. So in the last 10 days, what we've seen is a very large spike in cases amongst seniors. And again, these cases are underreported. So what we're looking at is case numbers now well above record rates for seniors. And knowing that those are underreported, that's telling us there's a huge wave of Omicron amongst seniors. Now, we know that most seniors are going to be double vaxxed. We know that many seniors are going to be boosted. That's going to help prevent an extremely large number of those people going to hospital. But they're still much more vulnerable than everyone else. So even a boosted or even a double vaxxed senior over the age of 80 with health conditions is going to be at risk if they get a serious flu-like condition like Omicron. That's going to put them at risk of hospitalization. That's going to put them at risk of serious illness. And we're going to see that show up in our hospitals. And the other thing we're seeing in the last little bit that we didn't see with Delta, we didn't see it with Wave 4, is that the virus is getting back into nursing homes and retirement homes. One of the things that is really important is that vaccinations worked so incredibly well at preventing illnesses with the previous Delta variant. Basically, if you had 2 doses or 3 doses, you were very unlikely to get sick in the first place. With Omicron, that's changed. Omicron is infecting people who are vaccinated. And that means we're now seeing a lot of those previous places where we had seen significant waves in the past, they're vulnerable again for those kind of waves. So we're seeing now a huge spike in declared outbreaks in Ontario's long-term care homes. And there's no worse place for infectious disease outbreaks than long-term care homes. So those are things that we should be watching too. Hopefully, we'll see that Omicron is less severe per case. It's going to result in less severe outbreaks and with fewer deaths in these facilities than in previous waves. But we're still going to see serious illness and we're still going to see hospitalizations as a result of those outbreaks.
Okay, obviously this is found in South Africa, and a lot of people are pointing to that jurisdiction and what has happened there in terms of basically there's a point where the cases peaked and then started to subside. Do we have a timeline for that here?
I should caution against taking too much from South Africa. South Africa has had a very different pandemic so far than us, and South Africa is a very different country than us. And specifically, I'm referring to age. The average age in South Africa is around 30. The average age in Canada is more than 40. We are significantly older, which means our population is significantly more at risk than South Africa. South Africa has also had previous COVID waves that have been much more widespread and much more deadly than we've experienced, which means a lot more people have had previous infection, which gives you some protection against the virus. So don't take too many parallels from South Africa. That said, South Africa's experience of having an extremely steep spread of the virus, it rose over the course of a couple of weeks to incredible highs and then crashed again, is what experts are telling us is the most likely shape of the epidemic in Ontario as well. So when we have public health officials talk about how long it'll take for Omicron to peak and subside here, they're talking about it in the course of weeks, not months. So we're thinking, a very sharp spread, and then it will fall pretty quickly after that. And that is, I suppose that's encouraging. It's hard for me to say that's encouraging when what that means is that the virus has run out of people to infect. The reason we see a sharp spike up and then a sharp drop down is that the virus spreads so quickly, it infects almost everyone it could infect, and then it goes away because there's no one left. Well, in reality, what that means is that almost everyone has got it, or a very significant number of people have got it. So to the extent that it's good to get it over with quickly, well, I guess, but I don't know that it's good to get it over with quickly if that means everyone is getting it and everyone who might be at risk of going to hospital is going to go to hospital all at once. That's not good. It's also not good if the staff members of hospitals get it, or the staff members of long-term care homes get it, or, the people in charge of clearing the snow from your sidewalk get it. Like, these are all bad things. So having that happen in a very short period of time is not great. And with Omicron, it is going to probably happen in a much shorter period of time than with previous waves, weeks, not months. But I don't know that anyone can look at the Ontario data right now and say it's going to end on this date. I think we're talking in broad terms, and we don't yet know.
I mean, obviously, you've been looking at this data for a long time, testing being overwhelmed, contact tracing not really happening. Like, how do we trust these numbers now?
Well, you can trust serious illness. We're still counting hospitalizations. We're still counting intensive care cases. We're still counting deaths. Those all matter. We haven't changed how we count those numbers, and we're not missing any of those. So to the extent that the case number is not capturing a wave that's overwhelming our testing, that's true. But I don't know that we need to give that a second thought when we have numbers that tell us what the actual impact of those things are. So, when you are looking at comparing Omicron to previous waves, look at those hospitalization numbers right now. They will tell you what the actual impact of this is in the places where seriously ill people are going for treatment, which is the number one thing that matters. And there's no reason to think that those numbers are going to become a huge undercount or anything like that. I think we're going to get reliable data out of those places, and that's what we should be looking at in the coming weeks. I mean, the other thing is just look around you. You will see Omicron affecting places around you when workplaces and city services and all these other places are affected by staff illness. We had libraries close in Toronto yesterday. Several libraries closed in Toronto. They're closing because they don't have the staff to run those places who aren't either isolating or infected with Omicron. So, the case numbers, I don't know that I would have a hyper focus on those right now, but there's lots of other ways you can check and see what the impact of the pandemic is right now. And those things are all telling us the same thing.
I think it tells us we're going to be in for a very interesting couple of weeks. And, the best thing for everybody out there is to try and take care and stay safe. Ed, this has been fantastic for us. Is there anything that I didn't ask that you think that our listeners should know?
I think one thing that you can get if you look so closely at the numbers is you can sort of get blown away by the data in something like the Omicron wave. And I do want to emphasize something, which is that vaccination and boosting really does work. If you are by yourself, you're vaccinated, you're double vaccinated, you may not be at much risk with Omicron. I can't say you're at no risk, but you may not be at much risk with Omicron. If you are around people regularly who are not vaccinated, young kids or very old people who might be more vulnerable, then I would be more concerned about Omicron. I'd be more concerned about spreading it to those people. I'd be more concerned about the effect on people around me. If I'm just talking about my own personal risk or your personal risk, vaccination really does help. So don't lose track of that. And if you are scared for yourself and you are a healthy young person or a healthy middle-aged person and you are vaccinated, it's okay to be scared. It's okay to be careful. But I don't know that you're at more risk from this one than you were in the past. I think what matters is the people around you and the systems of our society, like the hospitals.
Well, that is one thing that hasn't really changed very much. Ed, this has been great for us. Thank you for some clarity on some of these numbers, and thank you for your time today.
Happy to be here anytime.
Ed Tubb is an assignment editor at The Star who's been focusing on COVID-19 data. That's it for today. Thanks so much for joining us. I'm your host, Raju Mudler. Our This Matters team is Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachneck, Saba Etizaz, and Sean Pattenden. Our music is by So-Called, Mike DeAngelis, and Sean Pattenden. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.